it was really important to get that buy-in, to provide the education, to listen to what their concerns were.
Empowering our doctors to find small changes that can have huge benefits to the environment. Learn what Northern Light Health is doing about that today on Sustainable Healthcare.
Welcome, podcast listeners, to this edition of Sustainable Healthcare. I'm your host, Tim Doak. Sustainable Healthcare is part of our Healthy, Happy, and Wise podcast series designed to heal, inspire, and inform you. Thanks for being here. When we think about the unique role that healthcare plays in sustainability, one element we need to talk about is the use of anesthetic gases for surgery or procedures. To help us understand this better, we're pleased to have as our guest today Dr. Sarah Smith, Chief of Anesthesiology for Eastern Maine Medical Center in Bangor. Dr. Smith has been instrumental in identifying anesthetic gases as a sustainability opportunity within Northern Light Health and championing a transition away from a specific gas that is particularly damaging to the environment. Dr. Smith, we are so pleased you're joining us today.
Thank you, Tim. It's my pleasure.
It's great to have you here. So let's start with some basics. Can you explain what anesthetic gases are and how we might use them during the delivery of healthcare?
Sure. So anesthesia gases are inhaled medications that are used during surgery to keep patients asleep. So there are different types of anesthesia gases, Desflurane being one of them.
Right.
They all have different properties that fit some situations better than others. And so Desflurane in particular is unique in that it wears off quickly and allows us to wake the patient up more quickly after the surgery. This is particularly helpful, for example, for outpatient surgeries when the patient wants to go home that same day.
Okay. So these gases are inhaled by the patient during surgery. Tell us how that impacts the environment.
Yeah, so during surgery, most of the inhaled gases are actually then exhaled by the patient, collected, and then eventually released into the atmosphere. And these gases all have a specific GWP, which is the global warming potential. And so this is a measurement of how much heat a gas traps in the atmosphere compared to carbon dioxide over a set period of time. So Desflurane's GWP is thousands of times greater than carbon dioxide. And to make matters worse, it stays in the atmosphere for up to 14 years and continuing to trap heat all that time. So ultimately, it is a potent greenhouse gas with a long lifespan.
So pretty considerable impact when compared with CO2, as you mentioned. You did also mention there are several different types of gases that are sometimes used. Do they all have this similar impact to the environment?
No, there are different gases, and they all have differing impacts. They all have different GWPs, and therefore they kind of act on global warming in a variety of ways. Desflurane, though, is by far the most impactful to the environment because its GWP of 2,500 means that it is 2,500 times more potent as a greenhouse gas than carbon dioxide. The other inhaled anesthetics, sevoflurane, isoflurane, they have much lower GWPs. So they're still contributors to the greenhouse effect, but to a much lower degree by far compared to Desflurane.
Okay, so of these three different inhaled anesthetics, I think if we look at that purely from an environmental impact viewpoint, we'd want to use something different than Desflurane, certainly. What about the implications of that change? Is any one of these gases better for a patient from a clinical standpoint?
No, all the gases, they sort of have their own unique properties, but in general, we can provide a safe, cost-effective, and just effective overall anesthetic with any of the gases. So we are able to use as an alternative to Desflurane, sevoflurane, isoflurane as inhaled gases, but also we can use other non-gas techniques such as an all-IV anesthesia, as well as spinals and epidurals and
Sure.
nerve blocks.
Okay, that makes great sense. So we've talked about really how the various gases have various effects on the environment, and you just talked a little bit about really the impacts or lack thereof to patients as we think about how we select them. What about the economics of the situation? Is there any difference in the cost that the organization sees to buy each of these different gases?
Yes, when it comes to the inhaled anesthetics, it's more of a direct comparison, obviously. And so, of the three gases we've talked about today, isoflurane, sevoflurane, and desflurane, the desflurane is more expensive. And so, by reducing the use or eliminating the use entirely, there can be a cost benefit to the organization.
Okay. So Northern Light Health had a goal last year of substantially reducing our use of desflurane, knowing that it probably wasn't the best selection from an environmental standpoint. That work was very, very successful, and it actually resulted in a complete discontinuance of the use of desflurane across our footprint. You, of course, were our provider champion for this work. You did some amazing things, and you were really quite critical in the success of the project. How'd you convince your colleagues to do something different, and were those hard conversations?
The process actually went better than I was expecting it to.
Sure.
So, it started with assessing the group's baseline knowledge of and attitudes towards the use of desflurane. And then we followed that up with providing education of the environmental impact of desflurane, and then also just the alternative anesthetics. And we, use those all the time, but I think it was just letting people know these are things we can continue to incorporate more into our practice to replace that desflurane use. So this really did set the change for achieving that necessarily, quote, buy-in that I thought was going to be required to be able to suggest to the group about removing desflurane, or in the beginning at least doing a reduction. And that's what we ended up ultimately doing, was doing it in a staged process. Where we started with the reduction of desflurane, which eventually then led to the elimination of it entirely.
So from my standpoint, and I was involved with this together with our sustainability manager, Jen Boothroyd, and you two made a pretty amazing team as you stepped through this. I think it was absolutely critical that we had this work led by a provider. I'm an engineer. I'm happy to talk to a physician anytime, but I can't have the same quality of conversation with a clinician that another clinician can have. I think that was kind of a secret sauce in how we looked at this. What do you think your colleagues thought about having you available as a resource as they were considering, how to move in a different direction here?
Well, I definitely do think that probably makes the process easier. Because knowing that they can discuss the issues kind of in our own language,
right.
And then bringing those kind of clinical concerns. Because, desflurane, it has been used here and certainly other places for specific cases, specific patient situations, and just for provider preference. So, people did have some concerns regarding, geez, I use this all the time. This is my go-to gas. Please don't take it away from me. So we had to have this kind of tough conversations to say, well, I appreciate that, but I think we can talk about some alternatives, and I will support you, and we'll help to kind of make this implementation of desflurane reduction palatable to everybody.
How are things gone since then? I can tell you that from an economic standpoint, you mentioned the cost difference in the gas. I think if we quantify the savings from moving away from desflurane for Northern Light Health based on the volume we historically had used, it's around $50,000 a year, so pretty meaningful cost savings for us. From a clinical standpoint, how's it gone? Have there been any concerns or issues?
Actually, I haven't heard a single one.
That's
so
good.
I really do think it was very successful. And I think we were already on a pathway of not having a very heavy reliance on it, like maybe an outpatient ambulatory center would. So I think we were well poised to be able to undertake this. And so I think the attitude was very positive for most of the group. I think there were, as I said, a couple people who, were like, oh, please don't take this away. But once it was gone, you find alternatives, you find other ways of doing things. And so really there's been no complaints and no problems, at least that we've heard of.
That's a great success story.
Yeah.
So if there's someone out there from another hospital or health system perhaps that's listening and thinking about how they could affect change within their own organization, what advice would you have for them?
Yeah, so I think it's, kind of vitally important to actively engage with the group. I think it was really important to get that buy-in, to provide the education, to listen to what their concerns were. And so I think also doing things in a staged fashion as we did makes it a little bit, as I said, more palatable. It's just easier to make that transition to elimination rather than just shutting everything down all in one, fell swoop. So yeah, I think communication, education, getting the buy-in, and doing things in a staged fashion. It was successful here, and so those are what I would recommend for others to give a try.
All great advice. Dr. Smith, it has been fantastic working with you on this initiative. Thank you so much for being our guest today and for all your great leadership with this work.
Thank you so much for having me, Tim.
Thank you also to our podcast listeners. Until next time, I'm Tim Doak, asking you to think sustainably.
Thank you for listening. You can find new episodes on our website at northernlighthealth.org/healthy-happy-wise and on YouTube, Apple, and Spotify, making it easier for you to listen on the go on your favorite app.